Hi, this is Dr. Dave here with Renewed Concierge Physical Therapy, and one thing that I was hoping to do on somewhat of a weekly basis is to highlight some wins that my patients are seeing with our practice. And this week I'd like to highlight a patient of mine who came to me several weeks ago with pretty significant hip pain. And at the time I diagnosed him with what we call snapping hip syndrome. It's a form of tendinitis in the hip flexor muscle, just like you can get shoulder tendinitis or elbow tendinitis, and most people are pretty familiar with those things. Well, you can get tendinitis in any muscle, and typically the question is, why does it occur? Sometimes people are just overusing their muscles and playing too much tennis over the course of a weekend, but a lot of times people just get this random pain. Yeah, it just started hurting me. I don't know where it came from. I wasn't doing anything. And people get kind of frustrated with that. Why do I keep getting this pain? And so my job as an investigator of your body and your mechanics is to find out what that root cause is. And a lot of times that question is overlooked by clinicians. But this time around, I looked through the mechanics of my patient and found that his pelvis was rotated on itself. And anytime you change the mechanics of a muscle, wherever it attaches and wherever it goes, and you change the orientation of that joint, you end up changing the mechanics for that muscle. It puts undue stress on the muscle, and it can cause tendinitis, and that's exactly what happened to my patient. I was able to stabilize the pelvis and rotate it back to its proper position and alignment within 2 visits. And during that time, I performed some soft tissue work, massage techniques, cross fiber friction techniques to help calm the muscle down, reduce inflammation, break up some of the scar tissue that has built up over the last several months, and was able to free up that muscle quite a bit. His pain wasn't completely gone by the time I was done my 4th visit. However, I did follow up several weeks later, which was last week, and asked him how things were going after I established a pretty good exercise protocol for him to resolve all of his hip pain. And he has found that over the course of just 4 visits, he has complete resolution of all his pain, his pelvis continues to stay within good alignment, and he's demonstrating good mechanics. One thing that was really fun for him to say is, I didn't even realize I had back pain until you fixed it. And that was actually really encouraging to me. He always felt like he didn't have a back problem. But when I realigned his pelvis and I made him start moving properly, he was like, I didn't realize how much my back did hurt. And spent some time working on some of the core engagement techniques and some strengthening techniques for his core. And that was really satisfying to me, and I know it's certainly satisfying to him. And so at this point, he's pain-free both in his back and his hip, and now he's able to perform all his daily activities and go to work without pain, and obviously work out, which was his main problem. So in any case, I hope you enjoyed that testimony. You guys have a great rest of your day, and stay safe and stay blessed.